Hey, good morning, everybody. We're going to get started on our Physician Enterprise Grand Rounds. I want to do a very warm welcome for our speakers this morning. And before I introduce them, I want to sort of level set why we're talking about climate change today, and specifically around the fact that it is an important topic for all of us to learn more about and understand more so what is the impact that we have? What is our carbon footprint on the world as we move along in our everyday life at work and healthcare? So, really, our focus is more on the healthcare organization's climate impact. And this is the beginning of a conversation, many more to come as we continue to learn more. As we get started, I want you to think about this quote from Chief Seattle, which is, "We do not inherit the earth from our ancestors, we borrow it from our children." And it goes to really the work that this group of guest speakers has done so far and continues to do. So let me introduce them. We have Sister Mary Ellen Leciejewski. She is responsible for overseeing system-wide environmental sustainability initiatives. And in conjunction with her work in sustainability, Sister Mary Ellen facilitates communication networks among her colleagues and works closely with health systems and environmental organizations throughout the country to raise awareness of healthcare's impact on the environment and promoting programs that proactively address issues of sustainability. In 1975, she received a secondary education graduation from Wayne State University in Detroit, and she earned a Master's of Arts degree in ecology from the University of Illinois Springfield in 1995. And prior to joining Dignity Health, fun fact, Sister Mary Ellen spent 20 years teaching French on the secondary level in Michigan. So, by all means, if you speak French, you could type in your question in French. Um, Next, we have Kelly Paul, who is the Director of Training, Education, and Communications for CommonSpirit Health Supply Chain Team. Kelly leads vendor diversity and sustainability strategies, including serving as the lead for Scope 3 emissions reduction for the Climate Action Plan. We have Rachelle Wenger as System Vice President of Public Policy and Advocacy Engagement for CommonSpirit Health. She's responsible for advancing the organization's public policy priorities at the local, state, national, and international arenas. She manages policy issues core to our system's commitment to advancing health, social and racial equality, and justice, as well as her portfolio, which includes various social and environmental determinants of health issues such as housing, homelessness, immigration, climate change, nutrition, and food systems. She received her bachelor's degree in philosophy from the University of California, Berkeley, and a master's degree in public administration at the California State University, Northridge. And we have Rob Vandling as the Manager of Utility Services at CommonSpirit Health. Rob is responsible for providing leadership, strategy, and coordination related to procurement and efficient use of utility services. So when we think of electricity, natural gas, water, sewer, and other related utilities. He oversees CommonSpirit's utility bill management system, GHG, reporting initiatives, as well as helps to identify, implement energy conservation measures, and renewable energy opportunities. Rob has been with the CommonSpirit family for quite some time, since the fall of 2019. And prior to that was with Arizona State University as the manager of energy efficiency, helping them to also implement energy saving opportunities. He is a certified energy manager, certified carbon auditing professional, certified demand side manager, and a graduate from ASU with a master's degree in information management. So we have quite the team here. I will hand this off, but before I do, we do have a poll question for our audience members. John, if you could pull that up for us. Have you encountered patients affected by climate change? Okay, let's give it almost. All right. Okay, so we have a good distribution. This is great because I think the information we're going to receive today might be very helpful when we think about impact of our work in climate change. So thank you for that. I will hand it off to Sister Mary Ellen.
Great, thank you. And so, good morning, everyone. It really is a privilege to be able to spend time with you this morning. Thank you so much for the opportunity. Next slide. This morning, Rob, Kelly, Rachelle, and I will focus on healthcare's role in the ongoing climate crisis, how scope 1 and 2 impact healthcare emissions, how we can leverage our market and influencing power to create change, and our role in preparing and helping all those we serve from the impacts of climate change. Next slide. In the latest IPCC synthesis report, scientists from around the globe declared the evidence unequivocal. Human-caused activity is the overwhelming driver of climate change. It's affecting weather extremes in every region across the globe, and vulnerable communities who contribute the least to climate change are disproportionately affected. Next slide. And if we look at healthcare's footprint, we find that worldwide, the healthcare sector is responsible for as much as 4.6% of total greenhouse gas emissions. And that's equivalent to the annual greenhouse gas emissions from 514 coal-fired power plants. And if healthcare were a country, it would be the 5th largest emitter on the planet. Next slide. Now, the US healthcare sector contributes about 27% of the world's healthcare-related greenhouse gas emissions, more than any other nation, and as much as 8.5% of all US greenhouse gas emissions. So unfortunately, we are becoming more, not less polluting. And when this Healthcare Without Harm report came out in 2019, people were really surprised that healthcare, whose mission is to promote and protect health, makes such a huge contribution to the climate crisis. Next slide. So this graph was taken from the Action Guide on Accelerating Health Equity and Business Resilience Through Decarbonization. And it suggests that the reason for these high emissions from healthcare is driven by a few factors. First, while our high standard of care has a profound impact on quality of life, it also has side effects in the form of waste. Another driver is energy demands. Hospitals operate continuously 24/7, consuming huge amounts of electricity. Waste generation is another driver. The US hospitals generate about 3.4 billion pounds of solid waste annually. And our complex supply chains rely on extended distribution networks that drive emissions across the value chain. Next slide. So as emissions increase and climate change accelerates, human health suffers, and no one is safe from the impacts of a destabilized climate. But as the WHO states, those who are harmed first and worst are the ones who are the least prepared, who have the least resources to respond to health threats, and already suffer health inequities, such as communities of color, low-income communities, children, the elderly, people with underlying health conditions and disabilities. Next slide. In this 2017 study, the authors described each of these 8 health-harming pathways in about 150 words. So it was very short, very succinct, but they made the connection between what's happening to our climate, how it's harming our health, and who's most likely to be harmed. And the authors report that public health professionals are seeing increasing rates of health problems associated with climate change in their communities, including, and I'll just mention a few, but respiratory and heart disease and asthma due to the exposure of pollutants from wildfires or the smog. Higher pollen counts because of more CO2 in the atmosphere is leading to an increase in seasonal allergies, stroke, dehydration, illness, and death related to extreme heat. And extreme heat causes more deaths than most of the other health-related, weather-related events. And injuries and deaths from dangerous weather, especially when power is knocked out, homes and bridges are damaged, and people may not have access to medical care, or they get separated from their medicine or food or water. And just skipping to the last one, under mental health harms, PTSD, depression, anxiety, or grief following these weather-related disasters. And so this just brings to mind, I think, the words of Pope Francis in his encyclical Laudato Si', where he calls everyone everyone in the world to hear the cry of earth and the cry of the poor. And those cries are just becoming more heartbreaking every day. Next slide. So this is just one of the many climate and health models showing that erosion of the eco-determinants of health can undermine the social determinants of health, health systems, readiness, and human health. And as Dr. Guzman, director of the Inter-American Center for Global Health, points out, it's important that we not separate these factors because they're all interlinked and they're all happening at the same time. Next slide. And so this graphic from the action guide that I referenced earlier shows stakeholders who increasingly believe that healthcare has an obligation to reduce greenhouse gas emissions. And they include our communities, our employees who want climate positive action from their employers, payers, government agencies, accreditation bodies, and investors and donors who want a fuller understanding of the companies that they're investing in. Next slide. And so CommonSpirit is taking steps to decarbonize and be net zero by 2040 with an interim goal of cutting operational emissions in half by 2030. And to support that goal, we developed a comprehensive climate action plan, which is a framework for reducing our greenhouse gas emissions and just looking at what are the actions that would offer the biggest result. Next slide. And so the CAP, Climate Action Plan, consists of 3 pillars. The first focuses on buildings and operation. The second focuses on supply chain. And the third pillar focuses on climate resilient communities. So I'm going to turn this over to Rob Vandling now for a deeper dive on pillar 1.
Thank you, Sister Marianne. I appreciate the time today. Thank you, everyone. I'm here to talk a little bit about how do we identify exactly what our GHG emissions are. They're basically broken up into 3 different scopes. We look at scope 1 as the fuel that we burn on site. So we have our natural gas for our boilers or our diesel for our on-site generators. But this also includes our anesthetic gases that we use for our treatment of our patients. For scope 2, we look at everything that we purchase in regards to utilities as far as electricity, or if we have a district steam or chill water loops that we need to heat and cool our facilities. And with this scope 3, it's basically everything else. So we look at our procurement opportunities. We look at our, business travel, our employee commuting, our upstream leased assets as far as everything. So I'm going to take a little deeper look at scope 1, scope 2, as that being on the energy side of things, those are the most impactful that our National Real Estate Services as part of CommonSpirit has the impact on. So next slide. As Sister Marianne was saying, we've set some ambitious goals for our GHG emissions reductions, but we needed to first understand where are we to start with. How do we get a better understanding of what we have to overcome? CommonSpirit has 3.5 million metric tons of GHG emissions for all 3 scopes that we need to address. To put this in a little bit of context, as referenced in my previous engagement, I was with Arizona State University. At the time I was there, their overall emissions for being one of the largest universities in the nations was only 350,000 metric tons. So we're 10-fold increase and have to do this by 2040 to hit our net zero goal. But for scope 1, scope 2, that's roughly 25% of our goal by 2030, and we're looking to offset 50% of that value. So we still have a long way to go for 2030, let alone our achievements that we're looking for 2040. Next slide. This kind of breaks that previous pie chart down to exactly what we're looking at for our National Real Estate Services group that we're trying to achieve. The blue and green areas identify scope 1 and scope 2. The piece of the orange there is of the scope 3 that engages our leased assets. And I'll talk through a little bit of this in the next slides about what we're doing to achieve work through each one of those. Next slide. So for scope 1, scope 2, through our climate action plan, we set some goals on how do we move forward and reduce those. So we've set ideas where we're looking to implement opportunities of retrocommissioning, lighting retrofits. We're looking to do other energy conservation measures, renewable energy, things like that will ultimately reduce our GHG emissions and reduce the amount of energy that we're procuring and using in our facilities, all the while we're also improving the efficiency of our systems, addressing deferred maintenance, and making our hospitals better to operate for not only our facility staff, but ultimately for our patients and everyone else that visits the sites. Next slide. Retrocommissioning, as I mentioned, is the process in which we return our facilities back to where they're originally supposed to operate, making sure they're running at peak efficiency with the systems and equipment we have in place today. We're not looking to, this process is not so much looking to replace the chillers, but let's make them work more efficiently with what we have. We want to look at other opportunities, more capital approaches as well. But initially, let's first make what we have working. Dollars are tight for facilities, so we need to make sure we're working with what we have and making the best things work most efficiently. We're still planning for the future as dollars become available, but as we all know, they become tight right now. So let's have what we have work well. So next slide. Lighting retrofits, another low cost, easy way to do things to reduce our energy use. As you know, we have many fluorescent systems still in place that use like a T8 using 28 watts. By coming in and putting in an LED tube, we can reduce that 28 watts down to a 10 watt. And by sheer fact, we can reduce the energy used by those units whenever those lights turn on. So we're looking at lower energy use, lower utility costs, and by using that, we're ultimately reducing our GHG emissions. As you can see in the pictures below, we're also improving the lighting quality of our sites. So there's other benefits that are doing these projects that will also not only reduce GHG, but also have these effects of improving our facilities along the way. Next. We're also going to have to look at our new facilities as we construct them moving forward. We also want to make sure we're building efficient buildings and acquiring new buildings that are efficient. We don't want to be chasing and always having to do retrofit commissioning or other ECM projects on future buildings. We want to make sure we're building them to lowest possible standards of emissions, as well as what's called energy use intensity. So every square foot that they're used of energy that those buildings use, they're using at the lowest possible way. So we're building buildings that are highly efficient, using LEDs in the initial build. We're using energy efficient equipment through that. So once we get there, we're able to offset that later through what are called virtual power purchase agreements or offsets in order to ultimately reduce our GHG emissions for those sites. Next slide. And through all that, once we've done and made our buildings as efficient as possible, now we can come and look in adding renewable energy sources like solar, working with our utilities on acquiring renewable energy from them. We want to make sure that we're using as least amount of power before we want to build power plants on site, so that we can reduce the cost and the size of those systems in order to achieve renewable energy on site. So CommonSpirit is looking at all these type of options in order to achieve our 2030 and ultimately 2040 goals in going through this. And I believe that's the next slide. And I'll be turning this over to Kelly Paul to talk about our scope 3. Thank you.
Thank you, Rob, and hi, everyone. It's a pleasure to be here today. Scope 3 indirect emissions account for the upstream and downstream energy derived from our ministry's consumption. Today, I'll focus on the supply chain aspect of Scope 3. Our climate action plan goal is to reduce Scope 3 emissions by at least 90% by 2040. To reduce a large part of our Scope 3 emissions, we'll leverage our market and influencing power to create change. In the near term, we've placed focus on the most material Scope 3 categories, including purchased goods and services, capital goods, and the transportation related to those products and services. These three categories alone account for 64% of CommonSpirit Scope 3 emissions. So by engaging with our top emitting vendors, we can influence them to begin or enhance their climate action plans, disclose their emissions, and set goals. Next slide. What do the necessary actions look like? They include, one, understanding our suppliers. It starts with communicating our expectations and surveying them to understand what actions they're already taking today. Broad engagement with industry collaborators is necessary to identify and address greenhouse gas concerns and opportunities in healthcare. And finally, solutions implementation, reviewing and optimizing the processes that we already have in place across our facilities, and collaborating with suppliers to enhance and bring in new strategies to reduce our emissions. So next, we'll take a look at each of these in a bit more detail. Next slide, please. It's important for us to begin by understanding where our suppliers are in taking climate action today. When we look at our top emitting suppliers, we have 117 that were identified in our baseline data for prioritized engagement. Setting a science-based target really demonstrates an organization's serious commitment to decarbonization, and the number of suppliers that have either set or have committed to set targets has been increasing, as you can see here. And as we move forward, we'll continue encouraging more suppliers to take this important step and make those commitments. Next. Similarly, more of our suppliers have been submitting and being scored by the Carbon Disclosure Project. This helps organizations measure and manage their climate risks and opportunities in preparation of putting those climate action plans into place at their organizations. So again, the data, the movement of our vendors in kind of the green, the right direction here, has been increasing over the past few years. And we're certain that we're going to continue to see these numbers moving in the right direction. Those not responding, not submitting, not setting goals, we'll continue to see that dropping. Next slide. Decarbonizing our supply chain requires that we collaborate with industry partners and also participate in forums that allow us to share with and learn from healthcare leaders to enable broader impact. As signatories of the Healthcare Anchor Network's Impact Purchasing Agreement, we've made commitments to sustainability goals, including sourcing sustainable food, removing harmful chemicals such as PVC and DEHP from various product lines, and the primary 5 chemicals of concern from our environment. Last, reducing the use of inhaled anesthetic gases, especially desflurane, which is the most harmful of those to our climate. We also partner with Healthcare Without Harm, and specifically a subgroup composed of other healthcare leaders that are focused on establishing a climate excellence standard for vendors, and also influencing and educating vendors about decarbonization and the importance to us as their stakeholders. And next slide. Finally, I wanted to share just a few examples of solutions that are already implemented across our CommonSpirit Health facilities. So these include reusables, such as gate belts, reprocessing initiatives, including Stryker medical devices and lateral transfer devices that we collect at our facilities and send to be reprocessed. Recycling, such as the Blue Wrap collections in place at several of our facilities, and purchasing recycled copy paper. Chemicals avoidance, again, PVC and DHP, inhaled anesthetic gases, and the 5 chemicals of concern in furniture and furnishing. Purchasing local and sustainable food, and other strategies, such as implementing CAP-related questions into our RFP template, so that we start this conversation at the beginning of the relationship with each of our vendors. Again, these are really just a very small picture of the strategies we have in place, but they exemplify CommonSpirit's commitment to supply chain decarbonization. Thank you for allowing me to share. I'll now turn it over to Rachelle Wenger to speak to you about climate resilient communities.
Thank you, Kelly. Good morning, everyone. Let me just start by saying what a pleasure it has been to work with Kelly, Rob, and Sister Mary Ellen and the entire CAP team. CommonSpirit continues to lean in to ask, what is our part to do to advance climate smart healthcare? Our net zero goal is certainly our North Star. We're looking inwards to bring down our GHG emissions, as you've heard, within our hospital walls and around the perimeters of our facilities. Rob's team is definitely on the move. And because we know that our scope 3 emissions make up 75% of our total GHG, I'm just so proud of Kelly and her team and their laser focus in the way that we're journeying with our supply chain vendors to bring down their own emissions. It says so much about who we are as CommonSpirit and our leadership within the broader sector. We recognize that what's at play here is not just about climate change, an ecological crisis made up of a series of problems to be fixed, but rather a symptom of something that's much deeper. I would submit that at the heart of the ecological crisis lies a human crisis, in that we are forgetting who we are and where we come from. The third pillar of our CAP, I believe, gets at this point. The focus of our climate resilient communities work is about people, shining a light on who we are, our interconnectedness with one another, and human health's inextricable relationship with the health of the environment. It's a way forward for us all to come together to protect Earth, our common home, and I would add a way for us to bring innovation to our shared humanity. Next slide. We're certainly at the early stages of implementation of our CRC objectives, yet it is becoming clearer and clearer that this pillar is CommonSpirit's dedication to an integral ecology approach. Healing that's about meaningful encounter and how we place ourselves in relationship. It's listening to our patients and communities and understanding more rigorously their needs and with whom we partner to forge solutions. It's really about using our voice as trusted healthcare leaders, as well as leveraging our precious resources to create change, specifically in the policy arena and marketplaces. CRC work is led not by one department, but by many functions and draws all of us in to bring the work more vividly forward to ensure that our patients and our communities will be better prepared for the impacts of a changing climate. The CRC pillar is broken down into 3 focus areas: pop health, community health, and advocacy. Thanks to our pop health team and our colleagues at the Lloyd H. Dean Institute for Human Kindness and Health Justice for leading the development of a climate risk map. The goal here is to take publicly available data on climate risk and overlay that with our facility and clinical data to better understand and prioritize areas of geographic focus for interventions. We're looking to build up our clinical resilience for chronic disease management and prevention for those diseases amplified by climate change. And education of our care team and patients will be very key here. In the area of community health, we know that our hospitals, CHNAs, our community health needs assessments, have always been a great source of information about our communities. Work is underway with Michael Bilton and our community health team to further examine how we can retool our CHNAs to further surface what are our community's environmental concerns. They're working with Dr. Jackson's team to identify key climate indicators and that they can then incorporate into future health needs assessments. It goes without saying that understanding people's exposure to these indicators, coupled with other social and economic factors, will yield greater insight to people's vulnerabilities and how a community can build for resilience. For example, how it solves for exposure to extreme heat, the degree to which people may be affected by this threat, and how it provides for their ability to adapt to hot days. Now, in advocacy, my colleagues and I have been working hard in the policy arena to advance meaningful legislation. We're really very proud of the work that we've played in the passage of the Inflation Reduction Act. There are historic investments in climate and energy initiatives in that act that will certainly go a long way, and we're working now to ensure that IRA dollars will help fund some of our climate and energy related projects that Rob has described earlier. Now, guidance for the IRA are still being developed, and we are making sure that we're sounding the gong for our hospitals, that we're in it to win it. And meanwhile, where CommonSpirit has investments in certain companies, we're continuing to engage in shareholder advocacy to really influence them to mitigate climate change and other harmful environmental impacts, such as toxic chemicals and waste. Now, while companies are currently making commitments, my colleague Laura Krause, together with other investor partners, are pushing for strategies, really concrete strategies, to meet those commitments and for companies to be transparent about the progress that they are making. Last slide. When we published our CAP last year on Earth Day, the White House and Health and Human Services on the very same day also released their health sector climate pledge. Advocacy actively gave input to the administration when developing the pledge. It's no coincidence that components of it mirrors our CAP. Easily, we were one of the first signers. We've been very focused on an important deliverable this year. We pledged to have a climate resilience plan published by year's end. And thanks to our leaders in emergency management, Kevin Hart and Pedro, we're on target. They are working off of our current EM plans, or emergency management plans, to further build in climate resilience. The goal is to incorporate new strategies and tactics that our facilities can adopt to address potential increase in severity of climate disasters. And community partnerships will be an important component here, for we know that we cannot and must not do this alone. I've been so excited to work with our EM coordinators. They've been actively engaged. They're learning how climate change can inform emergency management planning, and they're currently surveying, identifying preparedness and response gaps. They've also been sharing their work with other healthcare systems, with Practice Green Health, to support the entire sector's efforts around this. A lot of work ahead within CRC, but very exciting work, to be sure. Sister Ankita, I'll stop here to give time for discussions and questions. Hopefully I've shared enough to tease you all and hopefully to invite you back. But thank you so much for your time and for listening.
Fantastic. Thank you so much for going through those different but really related and important aspects of this work. I know that Dr. McGinn is on the line with us, and I didn't know, Dr. McGinn, if you wanted to say a few words before we open it up to the panel. Okay, we'll come back to him.
Sorry, yeah, I'm in a noisy place, so just forge ahead.
Okay, got it. All right, thank you. You know, one of the questions that often comes up in my mind is sort of, how is this related to CommonSpirit Health's mission, right? And I think Sister Marielle and you and I spoke a little bit about this question. You know, how do you see the work you're doing, the team is doing in sustainability and the climate action plan? How is it connected to CommonSpirit's mission, and how are they related?
You know, yeah, that question does come up a lot. And, you know, in our mission statement, we always say we're committed to improving the health of the people we serve. And so we do want them to be well physically and mentally and socially. And so we address their clinical, social, and educational needs. But we also have this huge environmental footprint, as we've been talking about, with scope 1, 2, and 3 emissions and other, you know, things that sometimes contributes to disease and illness. And so when that happens, I think the more we can move upstream to address our environmental footprint, the less all healthcare really has to treat the health impacts of those practices later on. So I think that's how our work is integral to the mission of CommonSpirit. And it's just addressing those conditions that are making people sick in the first place. You know, it's considering the whole community in our solutions. You know, whose neighborhoods are most likely to be polluted or host toxic waste dumps? We started working on that, you know, 1996, 97. Whose water is most likely to be undrinkable? Whose kids are going to be harmed with what's going on? Think of all the plastic here that healthcare is using, who's going to be left behind. And I think it's also doing it in partnership with others. That's one of our core values, collaboration. So how wide can we make our tent? We've been working with so many for a long time: Healthcare Without Harm, Practice Green Health, Series, BICEP, other healthcare systems, our vendors, business partners, and then just making sure that I think the conditions for a healthy life are in place for everyone. And that includes the clean air, safe drinking water, healthy soil, nutritious food. So that's the foundation for our health. So I think all these things that we've talked about today is intimately linked with our mission of CommonSpirit.
That's wonderful. I think a lot of our audience members agree with you. I'm not sure if you saw those little emojis flying up onto the screen, but yes, I think many of us agree. And thank you for being so specific. And how is the mission related to the work you're doing? One of the things, Rob, I wanted to ask was, I was reading yesterday's headlines, and I think in New York Times they were reporting that the heat index is supposed to rise in the next 4 years. And when it comes to, and across, this is for everybody, when it comes to taking care of our patients, whether it's in the hospital, whether it's through our offices, but also when they're at home and we're making sure they have the proper utilities, how do you go about planning those things, and how do you plan 5 years in advance? And is there something that we should be doing now to counsel our patients about it?
Well, from a facilities point of view, we want to make sure we have the most up-to-date facilities that are working efficiently, so that we don't have to worry about the next one that's going to fail. So by having efficient systems and making sure our sequence of operations are in place, that we have reliable energy, that we have backup systems, N+1, we're making sure that our facilities are going to operate and be there when we need them in times of emergencies and times of crisis. So it's important for facilities to make that extra effort. And part of our mission for reducing our GHG emissions includes making sure that we have all that taken care of. As far as our at-home patients and those that we're trying to service them, we're here as a resource to them to help them look to how can they better serve themselves, educate them on what they can do for their own home facilities, and being a part of programs with our local utilities on helping them to improve their infrastructures and things like that. I'm on a board with the SRP program here in Arizona to help them look at their 10-year, 15-year plans ahead of time. How can they make sure that not only are they servicing the needs of the healthcare industry or local business, but are they servicing the needs as time goes on in different environments? If we have growth, if we have shrinkage, if we have high climate needs, how is utilities going to be there for our residential and commercial population? So we as CommonSpirit try to engage at all aspects with that, make sure we're providing the sites and facilities that are going to be there for them.
Thank you. Kelly, similar question for you, but I think from the vendor standpoint, right? Like, how do you influence them? What are the discussions that you have? And is there a role for like clinical guidance, or is this something that's readily accepted amongst the vendors now as sustainability goals are concerned?
Yeah, thank you for asking. That's a great question. Really the conversations that we're starting with vendors, we're finding that our vendors are just all across the landscape. As we've reached out and let them know our intentions, our climate action plan goal of 2040, and what part they have to play in that, being our scope 3, largest part of our emissions. Some of them have a lot already happening, while others, they understand that climate is an issue, but they're not quite there yet. And as we continue to move on down kind of the impact with our smaller vendors over time, I think we'll find even more that really need us to partner with them and help them understand what do the initial steps even look like to start this work. So we're really seeing kind of the broad scope even already of vendor action. And I think a big part that we can facilitate, from thinking of the connection between supply chain and our clinicians and physicians at the facilities, is it's every step along the way. When we begin looking at our vendors, are we talking about this with them? Understanding, do they have a plan in place or plans to do so? then when we put the contract in place, what products and materials are the physicians and clinicians using in their practice, in our offices, in our acute care facilities? Are we making those choices when we enter that requisition into the system to get supplies to our facility, that we are actively choosing the items that have these sustainability components to them? So it's certainly about the conversations with the vendors, but then it's also the kind of feet on the ground practices that we have day to day.
Thanks. And I think as we wrap up, I know there was a couple of audience questions that I answered offline. One was, can we share this information more widely, and can we share your slides with our audience? And I'm seeing nods, so that's a yes, for sure. So we'll send them out moving forward. And I think one of the major questions that's always in our mind, especially when we come together for these discussions, and I'll serve it up to you, Rachelle, first, but each of you may have thoughts around this, which is, how can our physicians and our APPs play a role in this work, right? Like, how can they engage? And what is maybe one or two things you want them to take away today that they can implement and think about in the week to come?
What a wonderful question, Ankita. And I think that we are doing this very thing right now, which is to learn from one another. And I'm just so grateful that we have this moment to kind of dig in a little deeper about this work and what we're doing at CommonSpirit Health, and for the clinicians on the line, to amplify that, to be more curious, to learn more, and if we're so lucky to be invited back, we can share more of what we're doing in this space, and to pull you all in. It was really wonderful to get your responses to the polling question, because I actually thought that perhaps 100% would be the answer to, we are treating patients relative to climate change. Because in fact, as Sister Mary Ellen mentioned, this is an insidious crisis. It affects all of us. It affects human health every single day at every single moment. We may not be so aware of it, at the outset, but I hope that this is just a start in terms of really digging deeper and opening up our hearts and minds to understanding really this intimate interconnection between the climate situation and who we are as people, what we're doing in the health arena, and how we're caring for our people.
Wonderful. Sister Mary Ellen.
Yeah, if I could just mention, what are some things? There's so many organizations out there that we work with that it would be great for clinicians to plug into. The Healthcare Without Harm Practice Green Health Physician Network would be one, and that's just noharm.org, and that'll get you there. The Nurses Climate Challenge is another one. I mean, you're with a group of people, clinicians that are moving in this direction, learning together, sharing best practices. Another one is online. I've been watching this Project Echo, which is a group of clinicians, physicians, all the climate impacts that are coming up and how to deal with those. Another one is Eco America, to become an ambassador, go through a training. And Dr. Mark Futernick from California Hospital Medical Center has a podcast. The name is escaping me right now, something about climate, but just a 15-minute podcast, which is really good. So just working with others, collaborating, so that we could get the message out and get this to our patients and our communities.
Fantastic. Maybe what we'll do is, in our follow-up after the grand rounds, we'll take some of those resources and put them right in there for people to access. So they don't have to take notes right now, and it'll be okay. All right, fantastic. I think we are at time, but really thank you so much for giving us a flavor of all the ways in which we can change what's going to happen in the future of our world. So thank you. And we think it's really the beginning of multiple conversations to come.